Dr. Robert Edwards, thank you so much for coming and talking at the 2019 GOMA Fall Conference. Tell us a little bit about your practice, if you don't mind.
Okay. Well, I'm a general surgeon. I'm practicing with a group called Horizon Diagnostics. We're a multi-specialty group in Columbus, Georgia. I've been there since 2000, marking my 20th year with them.
Good.
I'm very happy to be with those guys. They're really a good group of doctors. My practice consists primarily of treating venous disease, patients with chronic venous insufficiency, varicose veins, and spider veins. I still, as a general surgeon, do offer the traditional surgical treatments for gallbladder, hernia, those type of things, but it has really kind of tapered off over the years, mostly because of the predominance and need for having to treat people with this condition, which is very common.
Yeah, well, I'm sure. There was a lot of questions afterwards. You talked a little bit about use of foam in venous disease.
Mm-hmm.
Maybe you can explain a little bit about the kind of the tricks of the trade, if you don't mind.
Sure. Well, foam, the topic of using foam for treating varicose veins and even spider veins is something that's not new. It's been done throughout the world for many years, sclerotherapy, but until recently it was found that when you combine a sclerosant agent with a vehicle, and it started out with using air, and physicians would mix air with their sclerosant, and you get a nice vehicle of a sclerosant, which we call it foam. You can see it under ultrasound. The problem with it, though, obviously, is that the air is a stable vehicle, and you may get propagation of that foam up into the central system. And in a few patients who have what they call patent foraminovale, some of that foam can propagate into the arterial system, and they can get TIA symptoms. I choose not to use air as a vehicle. I like to use CO2. The downplay against that is that you get an unstable foam that breaks down pretty quickly, but that's the safety of the mechanism. I want my sclerosant to work in the varicose vein that I'm treating and not go anywhere. And if it does go anywhere, it's already broken down and won't cause harm to the patient.
One quick question that, here we are in Atlanta, and we think about Atlanta traffic all the time. And if a road closes down, it makes all the traffic on all the other roads a little bit harder. Does that apply for varicose veins and sclerosing them? Is that?
Well, absolutely. And the main problem that, the question has to go off the fact that many patients say, well, do I need these veins anyway for something else? And these bad veins are not circulating venous blood back to the heart, so they're in a backup, like a traffic jam. All we're doing by treating the trunks, the saphenous veins that are refluxing or have the significant amounts of pressure, is we're closing that road down and trying to circulate that blood to the deep healthy veins, which we know they're healthy because we saw them on our initial vein mapping. So overall, you're improving venous blood flow, you're improving or you're decreasing the chance of thrombosis, thrombotic events, and overall the patient's quality of life improves.
Certainly the pictures you showed dramatic improvement in some of these patients, and it sounds like symptoms have gone down. You showed the graphs that prove that. So you're doing great work. We appreciate you coming and sharing your knowledge with us.
Thank you. Enjoyed being here today.